Hello, everyone, and welcome to another episode of The Professional's Pulse. I'm Farida Musaddi, the CEO of Alphateh Technologies and partner at Cruisia Travel and Events. Well, heart disease is no longer just a concern for the elderly, as we all know of some of the very shocking instances that we hear around us. Today, it's increasingly affecting people in their 20s, 30s, and 40s. In today's episode of The Professional's Pulse, we would be discussing the alarming rate and the alarming rise of heart attacks amongst the younger individuals in our conversation titled Young Hearts at Risk. Why are heart attacks not just for the elderly? From silent warning signs to lifestyle triggers like stress, we explore the key factors putting young hearts in danger. Today, our expert guest, Dr. Krishna Prasad Bashyal, a renowned cardiothoracic and vascular surgeon, sheds light on how to recognize early symptoms, when to seek help, and what steps you can take today to protect your heart no matter the age. So let's welcome Dr. Krishna Prasad Bashyal. Dr. Krishna,
Hi.
thank you so much for joining us today on the Professionals Pulse. It gives me immense pleasure considering the fact that we've known each other since childhood. So it's all the more my pleasure to invite you to the podcast. And the topic that we're going to discuss today, something which I think needs urgent and immediate attention in everybody's life. So I think thank you so much for spending time from your schedule and being here on the show with us.
Thank you, Farid. Thank you so much. And thank you for having me here. It's a pleasure.
So, for everyone, Dr. Krishna Prasad Bashyal is a highly accomplished cardiothoracic and vascular surgeon with a strong foundation in both general as well as specialized surgical care. He graduated with honors from Russia and went on to pursue a master's in general surgery under TUTH at the Universal College of Medical Sciences, Bhairava. After gaining over 2 years of hands on experience as a general surgeon, he further advanced his medical career by completing an MCH in cardiothoracic and vascular surgery at the prestigious IOM Manmohan Cardiothoracic Vascular and Transplant Center, where he trained under renowned experts Dr. Bhagwan Koirala and Professor Dr. Uttam Krishna Shrestha. Dr. Bashyal currently serves as an associate professor in the Department of Cardiothoracic and Vascular Surgery at Kathmandu Medical College, where he combines clinical excellence with academic mentorship. Once again, thank you so much for joining us today on the Professionals Pulse.
Thank you.
So, to begin with, what are some of the key factors that you must have observed which are contributing towards the rise of heart attacks in young individuals who have not even crossed 40?
All right. So first of all, let's discuss, as to, why this subject that we're discussing right now is so important. So this particular entity is called as coronary artery disease. So coronaries are basically the blood vessels that supplies the heart. So
Okay.
the diseases that affect this particular vessel, which maintains the function, the supply of the heart, is called as CAD or coronary artery disease.
Okay.
So globally, there's this established data. This
Mm-hmm.
particular disease has become the third leading cause of death worldwide. In
Okay.
all populations throughout. And basically, so this heart attack, what exactly do we mean by this particular thing? So basically, when the blood vessels that supply our
Mm-hmm.
heart so that it functions well, it functions in the most pristine form. when by any kind of disease or any kind of pathology, when it gets obstructed, when it gets blocked, and this particular
Correct.
supply is occluded in any form, thereby rendering the heart deficient of the nutrients, the oxygen that it requires to work. So that leads to something called as myocardial infarction or a heart attack.
Okay.
So, and in general, the
Mm-hmm.
average age for having a heart attack, this is a general consensus, general data for having a heart attack in the normal population. For men, it's 65, and for women, it's
Correct.
72. All right, so this is like the
Oh,
average rate when it starts, when it's seen more often from this age.
correct. True.
But now in the recent years, the trend has become such that it's, like you've mentioned, it's being seen in the younger population. And when I mean younger population, so there's this particular definition called premature CAD, that's a premature coronary artery disease, when this affects in people, in men less than 45 years of age and women less than 55 years of age. So when this, you have this heart attack in this age group, it's called as a premature incidence, because this is not the normal age for it to happen.
Absolutely.
So, in fact, a few years ago, there was this study conducted in Europe, establishing what is the average incidence for having these premature CADs. So they found out a very astounding and a very striking relationship. So let's say the age of the uh, average person is 20 to 30 years. So the average lifetime risk of him having a heart attack is approximately 2 per 1 lakh people. So these incidences are divided, they are measured, or they are presented as per 1 lakh or per 10 lakh or per 1,000. So let's say
Correct.
in this age group, you have an average of 2 to 2.5 people per 1 lakh people having a heart attack. Let's say it's 30 to
Correct.
40. So
Mm-hmm.
this increases like more than 6 times. It becomes 17 to 18 per 1 lakh. All right. And when this, you just take it a notch up, to the next decade, and it becomes 40 to 50. So this becomes an astounding 97 to 98 per 1 lakh of population. So
Oh.
more than just the age of presentation, what this study also found out was what were the risk factors? What were the things that was most commonly seen in this subgroup of people? So
Sure.
one was the most common thing that was seen was a male gender. All right. So majority of the people in this having a premature heart disease were, male gender. The next
Mm-hmm.
second thing that was most common amongst these entire population was smoking. All right. So
Okay.
smoking was the next most common thing that was seen in this. Third most common thing was a higher cholesterol levels. It's called as dyslipidemia. So basically,
Mm-hmm.
dyslipidemia, it means that cholesterol has various subcategories. Let's say you have a good cholesterol, which is called as HDL. Then you have LDL, which is the bad cholesterol.
Bad
So
cholesterol.
when
Yes.
there's yeah, so when there's a complete shift of this ratio of good versus bad cholesterol on the other side, so your heart disease tends to be higher. Then the another
Okay.
risk factor that was seen very prominent was a higher weight as compared for your age and for your height. So let's say it is expressed in terms of a body mass index.
The
So let's say
BMI.
you calculate a body, yeah, the BMI. Let's say your BMI is higher, especially let's say if it's more than 30. So you
Mm-hmm.
are at a pretty high risk of having, this heart attack. And the
Correct.
last but not the least, common scenario that was seen in these people were that they had a family risk, that any one of their first line of relatives, they've already suffered from any form of cardiovascular disease, their first line of relatives or their siblings, or they themselves had a earlier onset of hypertension, that is high blood pressure, or
Mm-hmm.
diabetes. So these were the predominant factors. But now what is
Okay.
added up in this modern lifestyle is a lot of things like substance abuse, for example, excessive intake of
Mm-hmm.
alcohol, and then
Correct.
illicit use of drugs, especially cocaine. This leads to severe something called as vasospasm. It leads to complete narrowing of your blood vessels, and hence
Mm-hmm.
it can lead to heart attacks even if the blood vessels were relatively healthier. So yeah, these
Correct.
are the so this is what is most commonly seen. But now, if we speak about the general, as to what are the factors that lead in general for the development
Mm-hmm.
of heart attack. So and how we got these factors, it was not like just picked up randomly, um, just deciding, okay, let's just evaluate this factor, this factor, this factor, and let's just see which one is more prominent. So actually,
Correct.
historically speaking, there was a study called the Framingham study, which was done in probably in the 1940s. So Framingham was a place in Massachusetts, and this study was initially started with all the residents over there. So all the residents were evaluated, their first generation, second generation, third generation. So all the generation was consecutively evaluated, seeing as to
Correct.
what are the risk factors, what leads to a higher blood pressure, what are the good things that can reduce the risk of having this higher blood pressure. And
Mm-hmm.
so the most determinant factor that led to this cardiovascular disease was a high blood pressure, which is also called as hypertension. So how do we
Correct.
define this high blood pressure? As where do we say that we have a high blood pressure? So in general speaking, let's say when you have, so there are two parameters in the blood pressure. The upper one is the systolic, the lower one is the diastolic. So let's say when you
Yeah.
have systolic pressure, that is the upper pressure when it's greater than 140, and your lower or the diastolic pressure, well, it's greater than 90. So this is
Mm-hmm.
when when you're set to have hypertension. This is when you need to start taking medications. So this was an absolute risk factor and the most strongest one. So what happens when
Okay.
you're having continuous high blood pressure is that there's something called as persistent intimal injury. That is the inner lining of your blood vessels are damaged. So that leads
Okay.
to accumulation of the cholesterol, the high cholesterol that is in your blood. That leads to accumulation of cholesterol, which leads to the formation of a plaque. So what's happening is when the blood vessel is narrowed by this plaque, so one is that you start to develop symptoms early on. Let's say this plaque
Correct.
ruptures, all right. So that is when you'll have a heart attack. So
Okay.
this blood pressure is such a thing, it is, I think it is one of the most underrated thing in our society right now, because there's this misnomer or this myth, that people say that even if I have a little bit of blood pressure, I must try avoiding the medications, because once I start having them, I'm going to have to take them for the rest of my
For the
life.
lifetime.
But what
Yes.
they don't understand is to have medications and stay healthy is better than not to take medications and have either a shorter
Be at
lifespan
a higher
or
risk.
probably
Absolutely.
a poorer quality of life. All
Absolutely.
right.
Correct.
That's why this is also called the silent killer, because the moment you have a high blood pressure, you will not have symptoms outright. All right.
Correct.
It'll lead to slow damage of your internal organs, like kidneys, your heart, even it even affects,
And you don't even
your
realize what's
stroke.
happening inside until something major
Absolutely.
comes and you just collapse one day.
Absolutely. Sometimes, even the first presentation, even in the young people, the first presentation of a heart disease itself is a fatal heart attack sometimes. It's like it's too late
Absolutely.
already. All right.
Yes.
So, but the good thing over here, it's like, every dark cloud has silver lining. So the good thing over here is that this is treatable. And
Mm-hmm.
once you start treating it, even your risk of, you know, uh, having this heart attack kind of reduces. Let's say you have
Okay.
a blood pressure of any person has a blood pressure of upper blood pressure of 165. You take medications and you reduce this blood pressure and you bring it down to 145. So
Mm-hmm.
just this persistent reduction by means of medications and lifestyle measurements, will reduce your risk of having a heart attack in the future by up to 30%. So just imagine how great the thing we have today, it's like the magic bullet, in
True.
the field of cardiovascular medicine. Let's say your blood pressure is 155, and initially you were just able to reduce it by 5 millimeters of mercury. From 155 you brought it down to 150. So this
Correct.
itself will reduce the risk of you having any kind of a major adverse cardiovascular event by 5%. And this reduces
Okay.
your risk of having heart failure in the future years by up to 10 to 13%. So it's a wonderful thing actually, to have medications when you have high blood pressure.
Okay.
Yeah.
But considering all of these things that you said, sometimes it's very surprising that when we see people who are really fit, in the past we've seen a couple of cases even with celebrities, we feel that these are the people who take so much care about themselves. They gym regularly, and proper diet, and proper medication, and then still you come across and that one fine day just one heart attack, and it was fatal for them. So what is your take on that? Considering, yes, of course, in average cases or in other human beings, maybe we neglect things, we are not very particular, but these guys are extremely particular about their health, about their fitness and everything. Then how does that explain such fatal casualties?
Yeah, well, it's a very nice question, Farida. So, one of the things that we've, studies have seen, and there have been reports been made, is that even marathon runners, let's say, they run for tens of kilometers, maybe
Mhm.
hundreds of them. So, even marathon runners are at risk of having a heart attack. So, the reason
Okay.
for this being is when there is a mismatch between the demand and the supply, and also there are various other causes. Let's say we've heard of footballers having a sudden heart attack and collapsing in the field while playing. They've been training and they've prepared for it,
Correct.
but they collapse with a heart attack. So what so there are various entities. There's in these young high intensity people who are involved in competitive sports. So there's something called as a hypertrophic obstructive cardiomyopathy. So
Okay.
what that does is that it kinds of the muscle that which is along the way that transmits the blood from your left side of the heart to the rest of the body. So that muscle has thickened, it has hypertrophied. What it simply means that it has it's like it has become bulky without gymming. So that part of the muscle has led to so much of a bulk that the blood flow for the passage is being obstructed. So let's say when you're playing and when your demand for when your heart is pumping more, and when you work when you're running more, and when actually the need of oxygen for the heart is even greater, what is happening paradoxically is that the supply is kind of is being cut off
Cut off.
because of this
Okay.
enhanced. Yeah, so this is what is something in the medical field is called as a type 2 kind of a myocardial infarction, where the demand and the supply are not met in the proportion that it needs to be. That is one.
Okay.
And the second one is that you just mentioned about celebrities and having workout and everything. So a very significant aspect of this is also what I feel is our lifestyle measures and the amount of stress that we are taking in our day-to-day lives. So
Correct.
the other silent killer in our modern society right now is psychosocial stress. And in fact, amongst the various risk factors, like high blood pressure, smoking, which is the next leading cause of cardiovascular disease, and especially these causes that leads to this heart attack, is smoking. Then third is a high body weight. Then it is your cholesterol levels are imbalanced, and then you have a chronic stress. So which is a psychosocial factor. So psychosocial factor is not something that is just come up just that is being evaluated recently for its impact on the heart health. So this is in fact one of the risk factors which were identified by the Framingham study itself, and this is a very crucial element because chronic stress leads to production of constant production of cortisol, which is like a stress hormone. So all these stress hormones, these are steroids, so they lead to
Correct.
constant thickening of your blood vessels, and once your blood vessels thicken, the stiffness increases. It leads to diminished flow, and this stress also leads to it leads you to a state of chronic inflammation. So whenever there is
Okay.
persistent inflammation in your blood vessels, it's not a good thing. So it'll lead to probably organize small blood clots along your arteries, and spurts of blockages of these blood supply to crucial organs like your heart, your lungs, your kidneys. So this is a very important risk factor. And also what I feel is probably since we've come out of this COVID thing, even the COVID has left its own legacy.
Yeah, I
Since
was
we're
about
suffering
to
from,
ask you about this. Yes.
yeah, and since so it has left its own legacy. The long COVID that is being mentioned and that is being evaluated, is that why is it harmful is because it leads to a state of chronic inflammation. So anything that is chronic means it's persistent, right? So when the inflammation is like the swelling in your body is constantly going on, there's no rest for it. It's like you're working 24 hours, day in and day out. What is going to happen? You're going to crash. So that
True.
is that is what is happening to our blood vessels. So those people who are suffering from long COVID, or during the COVID, there were a lot of episodes of people having heart attacks.
Yeah.
People with suffering from leg, limbs ischemia. Their hands and
Correct.
legs were suddenly becoming black because they were not getting enough supply, because they were going to a state of vasospasm. Blood supply was completely cut off.
True.
So so this is the legacy of COVID.
Yeah.
So these are the various factors. So there's no one thing that leads to a sudden heart attack or a sudden angina. So the persistent
It's multiple
multi-modality,
factors. True.
multiple factors that contribute to this.
Correct. And in fact, as you mentioned, COVID, I was just going to ask because there have been a lot of theories that ever since COVID, the risk of heart attacks has increased. Some people also blame it on the vaccinations that were taken. So maybe that is leading. I don't know how true is it, but yes, there has been a lot of speculation going on that post COVID, the risk in heart attacks and heart diseases has increased significantly.
Yeah, well, actually, studies are still going on evaluating, the what is the extent of damage that COVID actually did. And although I'm not an expert, in infectious diseases, but what I'd like to mention, definitely, COVID has increased the risk. It may be marginally, but it has increased the risk as compared to someone who's not had COVID, by a few notches of having any form of vascular diseases or cardiac illness, or something problem with your lungs. And but on the contrary, having a vaccination, it kinds of confers a protection to you from having the adverse effects and the long term effects of this. So it's not like if you've taken a vaccine that you're more susceptible to having any kind of heart pathology or any kind of heart diseases, disease of the lungs. But what I'd like to say, that so far the studies that have been, that have come up and that have been published, they've all mentioned about, how vaccination actually is kind of protective for your health. So I don't
Okay.
think so there's anything adverse to it. I mean, definitely there might be a few anecdotal reports of adverse reactions, and these things. But I think when we speak of such things, we must speak of the broader population.
Absolutely, yes, yes. And as you
Yeah,
said, the theories and research is still going on. So I think we have
absolutely.
to wait for the correct results.
Yeah.
So, what are the early warning signs that young individuals often ignore? And how can they tell the difference between anxiety or acidity and actual cardiac symptoms?
Right. This is again a fantastic question, Farida. So I'll just say this, in a very brief and in a very subtle manner, that any pain that anyone experiences, irrespective of the age, I would say, young, middle-aged, elderly. So any pain that you feel constantly around, most commonly, so this is the most common presentation. Of course, there are very, various kinds of atypical presentations as well, but let's just speak about common things now. So any kind
Correct.
of pain that you feel, let's say after any kind of exertion, after any kind of physical activity, let's say it might be as little as walking a few steps, climbing a few stairs, maybe just, doing a slow walk on a treadmill. If you have
Mhm.
experienced pain around your chest, especially on the left side of the chest, your left jaw, your left neck, your left arm,
Okay.
any kind of pain that, you feel that this pain is also going to the back of my body. So any
Mhm.
kind of pain you experience in such a manner, which is related to any kind of physical activity, it needs immediate medical attention. And when I mean medical attention, it means like you need to go and attend a physician, your physician, your family physician, your cardiologist, whoever you're seeking medical help with. He needs
Correct.
to examine you once if you have these symptoms, and it mandates a detailed examination. And
Okay.
especially, so sometimes you have this kind of pain which is associated after meals. You have kind of a tightness in your chest, a kind of uneasy or constricting pain around your chest. So this needs medical attention, as opposed to, like you said, let's say if it's acidity, which is also referred to as heartburn. So usually
Mhm.
this pain is not associated with just physical activity. Let's say when you're just
Correct.
sitting and you're having some kind of pain just behind your chest, but nothing, anything around your left arm, your left neck, your left jaw, nothing like that. Even when you're sleeping, you are having. Even when you're sitting, you are having. You're walking a few steps, you're having that. So that is mostly that is heartburn or the pain by acidity. Anxiety, on the other hand, it's like more of you'll have kind of feeling of palpitations. Your heart is beating really fast,
Faster. Yeah. Correct.
yeah, faster than usual. If you're feeling you're having this fear of feeling of fear. So this
Correct.
is what usually relates to anxiety, and what I
Mhm.
said earlier would relate to your acidity or your heartburn. But
Correct.
if you have anything that any pain in your chest, left side, your left jaw, your left neck, your left hand, the left shoulder, that is related to walking a few steps, and in fact, if that improves with rest, that is more likely to be some kind of a heart pathology, and than anything else. And instead of just waiting and watching at home and trying various medications or or your Pudina and all these things, you just go and see a doctor.
Yeah. Because always, it's the other way around. When we feel that, okay, after rest, if I'm feeling better, maybe the pain was because I exerted myself. So then we tend to avoid going to a doctor. But on the contrary, it is more alarming, and that is when you should actually consult a proper specialist and
Absolutely,
give
absolutely.
yourself
In fact,
treatment.
I'd like to share a small incident. I mean, in one of the previous hospitals where I was working, so we had a
Mhm.
junior doctor over there. So unfortunately, he was having these symptoms of having pain around the chest, in the lower part of the chest, and while walking a few steps, especially that would happen, when he would come from his room to the canteen for dinner. And
Okay.
what he'd always thought was that was acidity, that was heartburn, and he would always take antacids, medications to ease your acidity. And this happened not just for a few days, it happened for a few weeks. He just kept on increasing the dosage of his antacids, instead of seeking proper medical attention, or going to his seniors, or um, and unfortunately in a few weeks, I mean, he had a sudden heart attack. It was a huge one, massive one, and although he was in the hospital, he couldn't be saved. So that was really unfortunate. A doctor himself having a heart attack, of having symptoms, but not seeking medical
Proper medical
attention,
guidance.
proper
Correct.
medical attention. So this is not something, a thing of cannot happen to me. So this is something that can might as well happen to anyone. And he wasn't
Absolutely.
overweight, he wasn't hypertension, he wasn't, he did not have high blood pressure, he did not have diabetes. So well, only had he come to any one of us a bit earlier, a lot of
Correct.
things could have been changed.
True, true. Yeah, because sometimes it's so sudden, from what you spoke. I experienced this with my own self a couple of days back. Someone whom I met just 5 minutes back. And then just after 5 minutes, or maybe I think 10, 15 minutes, I hear that the person is no more. So, and when you meet that person, you feel that the person is perfectly fine, nothing is wrong, but you don't know what's going inside. And as you said, sometimes, we are ignoring those warning signs,
Right.
and just thinking that maybe this could be because of exertion, or because of the heat, or because of any other reason, when it's very, very important in today's time to get yourself tested medically, and to ensure that all the parameters are taken care of well in advance, so that you can avert such kind of situations.
Very true.
Correct. From your experience as a surgeon, have you noticed any kind of a pattern in the type of young patients who require kind of cardiac interventions, and any surprising cases that you have come across in your career so far?
So actually, a few years ago, we had operated the place where I did my residency in cardiac surgery. So there we had operated on a young doctor. He was in his early 30s. So he had something called as a triple vessel disease. So basically, our heart is supplied by two main vessels, and one of them divides to form two. So that is how it becomes three main vessels supplied to the heart. So when you have a blockage in some amount of blockage in each of those three vessels is called as a triple vessel disease, and this is better treated by a bypass surgery as opposed to our conventional angioplasties that we do. So
Okay.
yes, so we operated on that guy, and he had a surprising presentation. But the thing was, he sought medical attention at an earlier stage. He had a chest pain, and he came to the hospital. So at that time, he was an angiogram was done. That is to see, what was the status of the blood vessels of his heart, and
Mhm.
so that showed triple vessel disease. So he was treated at that time, to save his heart from having further damage. And later on, when he stabilized, then he was planned for surgery, and then he was taken into surgery. So what needs to be kept in mind over here is that, so when there is a younger presentation of the illness, so always what is the reason behind this needs to be worked out. It's not just that you treat that particular issue at that time, and then
Correct.
you just keep him on regular medications, and that's it. That's the end of his treatment. So it's not like that. So treatment has to be multimodality. So
Okay.
definitely, so these patients are examined by cardiac surgeons as well as cardiologists. And so when younger the presentation, more the workup needs to be done as to why it has it presented at such a young age. Is it
Correct.
because of some kind of a genetic disorder that needs intervention, or is it because of a family history, or what is the cause that needs to be worked, and even the root cause needs to be addressed as well. So what we did
Correct.
was we kind of just treated the issue at that time. And but if his root cause is not treated, then he's bound to have that again, because let's say even the new vessels that we've implanted into him,
Correct.
so
Yeah.
even they are bound to have the same pathology what he previously had. So even the root cause needs to be addressed.
True. And I think somebody who is already having some kind of a cardiac problem, they need to then maintain regular follow ups with the doctor, regular checks, maintain a certain kind of lifestyle to avert such situations in the future.
Absolutely, absolutely. So, what needs to be also remembered over here is that just treating, the disease once doesn't mean that you will not need kind of, an intervention or treatment in the future. So that is the reason that all these patients, they need to be kept in surveillance. They will come for a
Okay.
regular follow-up with the cardiologists, with the cardiac surgeons, and let's say, if there is a new symptom, which is,
Hmm.
not aligning with their recovery, or which
Previous
is not
ones.
aligning
Yeah.
with their treatment course, and or he has symptoms despite despite the intervention, despite treatment, he has symptoms which is somewhat similar to what he had previously, then he needs to be examined
Correct.
again, and he might need a re-intervention, or his medicines might need to be modified. He might need a re-CEBG. I know what that is, a bypass surgery. So definitely,
Correct.
these patients, in a mandatory way, have to be kept in a surveillance mode for as long as possible, and that is how we'll come to know if something new comes up.
Okay. Coming to the very important question in this digital era where we all have more of a sedentary kind of a lifestyle and the stress from the high pressure jobs and the work environment, how is the heart health affecting millennials and the Gen Z?
Very true. So now what has happened in this modern lifestyle? So there are two things that have, really burdened us. One is, like you mentioned, a sedentary lifestyle, which
Correct.
is, working. It may be working for long hours, but working in a sitting manner.
Sitting
Sitting
manner.
for
Yeah.
7 hours, 8 hours, 10 hours, 12 hours. How much ever is required.
True.
The second thing that has come up is stress. So these two things, in this particular era, this has become like the perfect kind of a blend for all our heart diseases. It's like the perfect concoction, which is bound to take you along a path that is going to give you some kind of a heart issue.
Correct.
So sedentary lifestyle, and as I mentioned previously, chronic stress. So this is all what leads to increased cortisol levels, increased states of inflammation throughout your body. That's one. So what comes along with this is that your intake of unhealthy food, consuming more of processed foods, ultra processed foods, a cheeseburger on the go. So all this is what is going to, go and build up in your arteries, is going to reduce the
True.
flow to your heart, is going to, you might put on weight by having this, but it's not a healthy weight. And the
Correct.
next thing, stress. So stress, another, in fact, there was a study called the Inter-Heart study, and this
Mm-hmm.
study kind of evaluated the effect of psychosocial factors of stress, depression, of and what are the things that actually alleviates these things. So they found out. So let's say, if you have anyone who enrolls into a support group, the risk of having a heart health because of stress kind of reduces. Let's say someone
Okay.
who's having depression, it may be because of any reason, and he started taking medications, and his depression kind of relieves. So that will
Mhm.
lead to an improved heart health in the long run. So
Okay.
stress, as we stay, it's like, a constant stress on your brain is like a ticking bomb for your heart. All right. So
Right.
stress is not just for your mind, stress is equally for your heart as well. You must I mean we've all noticed at times of examinations, our heart kinds of races. Sometimes,
Correct.
if you're really nervous, we might be sweating. So that is a form
Sweating.
of short stress. But let's say this is happening all the time, with this monitor. We have
Mhm.
to meet deadlines, presentations, we have to achieve the targets. So all of
True.
this is like, it's like, one thing leads to another. This
Correct.
cycle of achieving targets and meeting deadlines and presentations never ending. So
True.
what we need to do is we need to be aware of this situation, and we probably need to take a step back, because we might be working, let's say, working very hard for 5 years, but let's say on the sixth year our health completely declines. So all that work that we've done, everything is going down the drain. So
Absolutely.
yes, stress, sedentary lifestyle, and unhealthy food habits is all, this is mixture that is going to, lead you to a complete massacre of your arteries, of your heart. So we can't stay away from it, but
Mm-hmm.
we definitely can take measures to kind of,
Prevent it.
ease the burden that imposes on our health.
True. True. That's true. So, continuing from here, what are some of the tips or some of the daily habits or lifestyle changes that you would suggest that people should adopt in their day-to-day life so as to prolong such kind of adversities or such kind of problems?
All right. So, we're all very busy, and we don't have time for sometimes even to have breakfast or lunch or dinner. We skip meals, we take shorter meals. So definitely, so we can't say like, you need to go on retreat, or you need to
Correct.
exercise vigorously every day. So these things are not possible. But we can do certain things, which is clinically proven, to
Hmm.
actually ease the burden on your heart, to kind of make you more healthier heart wise and health, and hence as a whole. So one of the things that I mentioned previously, the Interheart study that showed was mindfulness. Any kind of activity with mindfulness. It might be just
Okay.
sitting quietly without doing anything. It might be, if you have any small hobby, painting, scribbling, anything at all, that kind of eases the stress out of you. Even for a few minutes a day, let's say even for 3 to 4 minutes a day, will definitely contribute towards a more peaceful mind, and hence a better heart. The second thing that is recommended by various organizations like the American Heart Association or the American Cardiac Society is that certain duration of physical activity is needed. So
Okay.
on an average, it is said that a moderate intensity of exercise, let's say, which is
Mhm.
amount to 150 minutes per week. Let's say if you divide that, that
Okay.
comes approximately 20 to 25 minutes of
Okay.
moderate intensity. So what does moderate intensity mean? It means a brisk walk. It could be anywhere.
Okay.
It could be around. It could be in your gym, in your treadmill. It could be around your society. So any at least an average of 20 to 22 minutes of moderate intensity of workout will definitely reduce your risk of having heart attacks. The
Okay.
second one is, as I mentioned in the risk factors, we also need to kind of remove the risk factors that are contributing to this increased risk. So one I mentioned, as I mentioned, is keeping your blood pressure in check.
Yeah.
And the second one, as I mentioned, is smoking. So smoking,
Okay.
we have this trend nowadays, I don't smoke much. It's just, one or two cigarettes a day. So that is the myth that all of us are carrying with ourselves. Just smoking maybe just 1 to 4 or 2 to 3 sticks a day is not going to have much of an effect because it's such a small number. So that's untrue. So what has been evaluated is that, let's say, anyone who smokes 1 to 4 sticks per day has a 1.5 to 2.5 times greater risk of having a heart attack as compared to a population that is not smoking. Someone
Correct.
who's smoking more than 5 sticks per day, like, around 5 to 10 cigarettes per day, so he has 3 to 5 folds risk of having a heart attack as compared to the normal population. Unless someone who's smoking, there's a cutoff of 20 sticks per day. So if
Too
someone
much.
who smokes 20 cigarettes per day, so it's like he's writing his own destiny. He's doomed to have a heart attack. So
Absolutely.
these are
And
things that
sometimes
you
when you
can
are in
do and avoid. Yeah.
and when you're in an environment, you are, there are passive smokers around. So there's an active smoker, and the ones who are around you, I think even they are at an increased risk
Yes.
of such
So
kind of.
even a passive smoker is like he's smoking 1 to 2 cigarettes per day, when he's constant in a
Absolutely.
constant environment of smoking. So passive smoking itself leads you to an average risk, as I mentioned before, 1.5 to 2.5 folds of having a heart
Correct.
attack. So if the passive smoking is, it might be passive, but still it is adding that burden on you. Then the other
True.
one is, in this modern era, is the environment. So with this pollution increasing and with the climate change and everything, and so studies have shown that, there's something called the PM 2.5, that's particulate matter 2.5. So when you're in this, so this is the kind of dust that is released by industries, the particles from the tires of our vehicles and
Mm-hmm.
industrial, vehicular combustion. So these release these fine particles.
Okay.
So when there's this PM 2.5, when you're exposed to certain bursts of this kind of small particulate matter, so your risk of having a heart attack also increases in an acute and significant way when you're exposed to large volumes in a sudden matter. Because what happens is these particulates, when we inhale these things, they just don't stay in the lungs. They're so small, they tend to trickle into the blood vessels as well. So this blood
Okay.
vessel, blood going to various organs, the heart, your lungs, your kidneys, so it is going to impact adversely, definitely. So this is
Okay.
another thing that is, technology and our modern lifestyle has given us.
True. So, any kind of tests that you can recommend, which a person can, have regularly, because we have our body health checkups. So, such kind of heart health checkups that we can do on a regular basis, maybe 3 months, 6 months, to keep track of the health of your heart and any kind of warning signs.
Right. So, what do you say? So all of these tests, so they are recommended for, what is the kind of population that needs the tests. So let's say
Okay.
someone who has a low risk for having a heart
Mm-hmm.
disease, all right?
Mm-hmm.
Let's say versus someone who has a higher risk of having a heart disease. So who will be
Correct.
someone who's having a high risk? Let's say he has a hypertension, that is increased blood pressure from an earlier age. He's an active smoker. He's had previous heart health issues. He has a strong family history, a genetic history. So he's someone who has a higher risk. So it is said
Correct.
that for, let's say, as simple as a blood pressure to be checked, it should be done from at least from an age of 18 years and above. And let's say your blood pressure is in the normal range, so you can do it 2 yearsly. But let's see the blood pressure increases, so definitely again you need to go to the physician, and it needs to be graded. What is the stage of that blood pressure? Is it pre-hypertension? Is it the first stage of hypertension? Basically
Mm-hmm.
just to know as to, will this get will this reverse with your lifestyle modifications, activities and diet, or will this need medical attention?
Medical
Then
attention.
other
Correct.
blood tests that you can do is someone, let's say, who's had a low risk. So an average age I would suggest is 35 to 45 years. Someone who's
Okay.
having a low risk. Someone at a higher risk, definitely earlier. Definitely earlier. So in the
Okay.
blood test, what are the tests that we can do? So there are, thousands of blood tests that can be done from the blood, but all of them are not necessary. So some
Okay.
basic blood tests that are important, I would suggest a renal function test, to take the condition of our kidneys, how they are,
Mhm.
because a persistently elevated blood pressure will also kind of have an impact on our kidneys. So that is
Okay.
that is one important thing. The next most
Mhm.
important thing that needs to be checked is our cholesterol levels, which is called as a lipid profile. So you can check all the spectrum of the lipid, your cholesterol, your LDL, your HDL, your VLDL. Then also there's something called as apolipoprotein A. So this is something which is genetically related. So let's say someone who has this LPA factor as well. So he needs to be checked more vigorously and from an earlier age as compared to the normal population.
Okay.
And with this, then you also need to check your blood sugar levels. Someone who is diabetic will have to have a blood pressure which is absolutely, as far as possible, less than 120 by 80, versus someone
Mhm.
who is non-diabetic, maybe even a 130 by 80 is acceptable for him. But if he's diabetic, then even, of course, besides keeping his blood sugar in control and follow up with his regular physician, even the blood pressure association needs to be kept in check. And let's say you've already suffered some kind of a heart health issue. Let's say you've had angina previously and you've been treated for that by any kind of angioplasty or a bypass surgery. Then definitely along the accordingly your tests will have to be routinely, semi-annual or annual, depending upon which stage of recovery you are. That will also include something called as an echocardiography, which is again ultrasound of your heart, to examine how well your heart is functioning, how well it is pumping. Is there any
Right.
kind of weakness in your valves or no? So that is what will give the overall picture.
Okay. Lastly, message, would you like to share with everyone who's listening to the podcast, uh, who also think that it won't happen to me? So, what would be your parting thoughts?
So first of all, this needs to be kept in mind. It's happening sooner and faster. So
Correct.
we let's assume that for our hearts, the 40s of the hearts is like the 60s of your age. So although you might be we might be 40 in our 40s and 50s, but we have to assume that probably our heart health is in our 60s unless it is checked. All right.
Correct.
So we
True.
must never dismiss anything very conveniently. And
Absolutely.
definitely, if this this podcast and this video of ours is shared by other young people, budding young and busy people in their daily lives, so they also need to realize that heart health is of vital importance. If we take certain small measures at this step, we can avoid fatal and life altering changes in the later part of our lives. So definitely,
True.
the sooner we act, the better it is.
Absolutely. And I think that's really important, really crucial. From all those things that you've shared with us today, I think it also, again, makes that point or the fact very, very true that heart attack is not, or heart problems is not only for the elderly. In fact, as you mentioned, it's coming for everyone and it's coming too fast. So now is the time to act. We can't think, or we can't wait for any time longer. Regular checkups, regular looking out for any kind of warning signs, meeting the right kind of specialist. So I think all those things are extremely important, considering the kind of lifestyle that we are living and the high stress that we are surrounded by. So once again,
Absolutely.
thank you.
And
Yes.
I'd like to just add one small thing, that just in case you want to, assess what is your risk of having a heart attack or any kind of thing. So there's something, online, there's something called as a Framingham risk calculator, which is available, and it's
Okay.
available to all. So you can just go to the website, you can add the details that it asks for, and it will calculate the risk of you having any major cardiac event for the next 10 years. All right. So that will
Oh
also
wow.
give you a fair idea, as to where do you stand as opposed to your heart health, your current situation. What are your risks? How early should you seek someone to treat this? So that is a very handy tool actually, and I'd advise people to use it, and it's free.
If you could just name it once more.
It's called a Framingham Risk Calculator. Framingham. Framingham.
Okay, absolutely. I think that's wonderful. And thank you so much for sharing all of these insights with us today on this episode. I think it was really, really informative for everyone. And I can see there are a lot of messages also which are coming throughout, that everybody's finding it very insightful. I think this was much needed. So thank you so much for giving us your time and your thoughts, and clearly and in very simple words, making everybody understand how important it is to take care of your heart from an early life onwards. So thank you so much for all for this time, and for coming to the Professionals Pulse.
Thank you for it. The pleasure was mine as well.
So, signing off, thank you for tuning in to this vital conversation on heart health. Remember, your age doesn't make you immune, but your awareness can make all the difference. Stay informed, stay proactive, and take care of your heart. Until next time, this is the Professionals Pulse, where every beat counts. Thank you, everyone, and have a nice weekend. Bye bye.